The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So Dr. Hamilton, one of the things is, of course, as plastic surgeons, we differentiate the two. For the upper eyelid, blepharoplasty, upper eyelid lift, what things do you like to do as a plastic surgeon to really rejuvenate that area?
That's a great question. So I think the modern upper eyelid surgery is about preservation as much as it is removal. So we are looking at the layers of the skin, followed by some of the muscle that allows us to squeeze our eyes shut, and followed by some fat pads. And those are the main considerations for the upper eyelid. Old school upper blepharoplasty, they used to take out all the fat that was here, and that maybe looked great in 35-year-olds, but as time progressed, it would make people look almost skeletal in appearance, because we actually we realize now we love fat in the face. Dr. Kim and I are always, we're adding it back in. We're injecting it all over the face and adding volume. So now I remove the extra skin, whatever can be pinched, so that I keep that incision exactly in the eyelid crease. I like to remove a little volume from the inner fat pads, or the ones close to the nose, to open up the inner eye area, but I just reduce it. I tighten up the muscle and then do a meticulous skin closure so that that incision heals really, really beautifully. And that's my favorite way to do upper eyelids. What about you?
Very similar to you. And of course, we know that the upper eyelid has sort of like fat pockets, fat pooching, fat sort of laxity that causes a slight bag in the upper eyelid. But really the big thing in the upper eyelid is not having too much hollowing of the upper eyelid. And that's important to realize when we're doing surgery there. With the lower eyelid, of course, we're worried about much more about the under eye bag. We're worried about this line here caused by a ligament. And finally, I do think that we know this, but patients don't know this. There's actually usually not that much loose skin of the lower eyelid. There's a little less.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.